Getting a blood clot either during or after pregnancy is still one of the leading causes of maternal death here in the UK. And the latest Embrace data highlights that it is the biggest reason, sadly, for maternal mortality between 2021 and 2023. If women have risk factors for developing a blood clot either during pregnancy or following birth, then there will be recommendations made to have blood thinning injections to take yourself. Other ways to reduce the chance of blood clot include keeping yourself really well hydrated, so drinking plenty, though no more than 2.5 litres a day, and also using thromboembolic stockings, so using the compression stockings too. Midwives assess risk factors during the booking appointment, and if you score usually 4 or more, that requires antenatal blood thinning injections. After birth, there are lots of reasons why you might be recommended to have blood thinning injections. This is all taken off of the RCOG Green Top Guideline, which was published in 2015 and is currently going through an update. There are some challenges with the length of time women are recommended the blood thinning injections for, and I'll go through that now. So across the country, if you score less than 2, you don't require blood thinning injections. If you score less than 2, hydration and potentially stockings if you're a little bit immobile will be recommended. When you're mobile, up and moving around, then of course the stockings can go. Anyone who is intermediate risk, so that orange risk, needs at least 10 days of having the blood thinning injections. Anyone who's high risk has at least 6 weeks. Now, one of the challenges is that it does also advise that anyone who has 3 or more persisting risk factors, you should consider extending the blood thinning injections into at least 6 weeks postnatal. Looking down this list, you've got being over 35, obesity, so BMI of more than 30, having 3 or more babies in your life, being a smoker, having an elective caesarean birth, a family history of blood clots, low risk thrombophilia, so low risk blood clotting disorders, having gross varicose veins, having a current systemic infection, so if you've had sepsis or chorioamnionitis, that is another risk factor in itself. Being immobile, for example, if you've got some sort of disability or you're having long distance travel, current preeclampsia, multiple pregnancy, a preterm birth in this pregnancy less than 37 weeks, having a stillbirth, having a mid-cavity rotational operative delivery, so having things like a high forceps birth, prolonged labour or a postpartum hemorrhage of 1 litre or more. The moderate risk factors include having an unplanned caesarean birth, so when you've gone into labour, having a BMI of more than 40, having a readmission into hospital for things like infection, for example, any surgical procedure except for the repair of the perineum. So it might be that you've needed a manual removal, for example, maybe there has been a postpartum hemorrhage that you've had to go back for, and also any sort of medical comorbidity, so things like cancer, heart failure, having things like lupus, for example, having things like type 1 diabetes, sickle cell disease. And those that are highest risk that need at least 6 weeks include having had a previous blood clot, anyone who's had the blood thinning injections during their pregnancy, if they are really at high risk of having a blood clot themselves. And what your midwife will do is score you immediately post-birth and also before discharge. Now, the difficulty comes in when there are 3 risk factors, because some of these are transient. They can go, for example, like infection. It might score you at one point, but once you finish the course of antibiotics, usually about 7 to 10 days worth, then actually that risk factor is no longer there at 10 days. And so there is a little bit of variation across the country when women score more than 3 risk factors, whether they have 10 days worth or 6 weeks worth of blood thinning injections. That's on a doctor's discretion. Now, the aim of the blood thinning injections is to help reduce the chance of blood clot, but it's important to note that some low molecular weight heparins, that's the blood thinning injections, are derived or made from porcine, which is pigs. So if you're vegan, for example, unable to have pork products, you may want to discuss with your healthcare provider for an alternative blood thinning injection. There are some that do not contain this and are not made directly with this. It is used to make it more bioavailable within the body, but there are alternatives that are available. So have a conversation with your doctor if this is the case.